Hello and welcome to the show. This is Life on Life Terms. I'm here today with Dr. Mehmet Oguz.
Yes.
Very nice to see you again, sir. We met each other in Turkey in 2017, and I was going for therapy, and I wanted to get EMDR therapy. I was interested in this, and I wanted to find out more about it. Could you tell us a bit about that, Dr. Mehmet?
Okay. EMDR means eye movement desensitization and reprocessing. That means a therapeutic approach for the psychological traumas. EMDR is found in 1987 by the French Shapiro, and it was accepted in 1996 nearly all over the world as a scientific method. It is done very much to very much people in Turkey in 1999 earthquake, Istanbul earthquake, Adapazarı, and then when I was very interested in EMDR in 2009, not 2010, in Turkish Air Force by the traumatic soldiers and military personnel. About 12 years, I am mostly interested and worked in EMDR therapy. EMDR therapy makes that in our psychological traumas, if you can't mediate the events or our life by the EMDR therapy, by following the eyes, it is done like the REM sleep, like that. While we are dreaming, our eyes close, and the memories in the right part of the brain and limbic system and amygdala moves to frontal part of the brain. By this way, the emotion change and the cognition change. EMDR therapy does by following the hands, like the eye glimpsing in the dream, moving the traumatic memories from amygdala and limbic system to the frontal part of the brain. I explain my patients like this. We are taking the folders like in a computer from C to D part. By taking the folders to D part, C part works more energetic, and then we can use our intelligent quotients and our emotions more better.
Fantastic. So that leads me to the question, what is PTSD?
PTSD means post-traumatic stress disorder. Post-traumatic stress disorder occurs when a traumatic event happens. Some people, some sensible people, has this trauma, and the trauma is shifted in the right part of the brain, in the emotional part of the brain. By sometimes later, this trauma occurs. Sometimes the commander of the brain. For example, here, when I am sitting here, if an earthquake occurs, and if there are 3 people here, and one of them is sensible and the others are not, that person in that earthquake is traumatized, and then by time, by months, he or she can't enter here again, because when he entered here, the traumatic part activates, and you are not insecure, you will die, etc. says, and he or she can't enter here. By EMDR therapy, by following the eyes, or by listening beep, beep, beep ears, or the tapping, and by studying that trauma, the traumatic memory moves from emotional part to frontal part of the body, and I am not insecure, or I am not confident. Cognition changed to it has become and finished. So a post-traumatic memory cognition changed by EMDR therapy.
That's great. We'll be right back.
Okay.
Welcome back to the show. We're here with Dr. Mehmet Oguz from Izmir, Turkey. Pleasure to have you on the show today on Life Terms. Thank you for being here. So we're talking today about EMDR therapy and PTSD, and maybe a different range of different therapies that are available for people who are seeking help. Simply, yes? What would you say to that, Dr. Mehmet?
Yes, there are a lot of therapies that can, therapeutic techniques that can be done in traumatic disorders. But after the foundation of the EMDR therapy, especially in the post-traumatic stress disorder, EMDR therapy seems to be gold standard now in all over the world. By the foundation of EMDR therapy in all over the world, a lot of EMDR therapists were educated, and they learned EMDR therapy, and EMDR therapy it has been done in all over the world, especially in Middle East. These traumas are very important, and the time is very important. We can treat in a short time the people. EMDR therapy treats the PTSD patients faster than the other therapeutic techniques also.
That's very good. That's very good. Can you tell us a little bit about your practice in Izmir? What it's like to be in Izmir?
Izmir is, I like Izmir. I am an Aegean. I was born in Uşak, near to Izmir, and I live in Izmir especially 8 years. Before, in my childhood, a part of my childhood was also in Izmir. About 10, 13 years, I worked in Turkish Air Force, and I was in various parts of the Turkey. But after separated from the Turkish Air Force, I came to Izmir and started to work in Izmir. In 2016, I had my office in Izmir. By time, I was I had done very good job in EMDR therapy, and now all over the world by online or face to face, a lot of people, a lot of patients we have. We are 3 friends in our office. A psychiatrist and a clinical psychologist also. After a pandemic, also we started to work in virtual reality treatments with EMDR therapy. By
Virtual reality treatments.
Yes, yes.
Wonderful.
This is we have done very good job in virtual reality treatments. We have a dynamic therapist also, you know, that Dr. Nihan, by her and a clinical psychologist, we work EMDR therapy plus virtual reality therapy. That is very effective also in some PTSD patients.
That's wonderful. We'll be right back. So, thank you for being on the show, Dr. Mehmet. We're here talking about lovely Izmir. If anybody has traveled to Turkey, Izmir is definitely the place you want to check out. Some of the best food, I mean, really, and the weather is amazing. It's like the Riviera. It's on the Aegean Sea.
Yes, Izmir is a wonderful city. Also, you know the Izmir. The people is different in Izmir, like a Mediterranean countries, Italy, Spanish, or Greece. The people's character, also the behaviors, the joy in Izmir is very good. A different part of the Turkey. Also this year, a lot of people migrated to Izmir, and very different colorful things occurs in Izmir. We know here in the near future, I think the health tourism center will be Izmir. So we are
Which center? Which center?
I think health center, health tourism. Tourism,
yes.
Yes, in different countries, different people will come here. Izmir is growing and very good growing. It's like a Greece city or an Italian city, like, and we love Izmir.
Yeah, we do love Izmir. It's great. So, how did you get started with EMDR therapy? How did you get interested in this topic? Yeah.
Okay. In my childhood, I was a different child. I was looking the people, what are they doing? How are they doing? The behaviors, and I was a sensitive child. By time after the medical faculty, I have tried to psychiatry, and in psychiatry, I didn't have education in psychiatry assistancy. I didn't have EMDR education. I studied with the professors, but about all the psychological drugs. But I didn't like this this pharmacological therapy. At the end of my psychiatry assistancy, I learned EMDR therapy, and I know my pain from my childhood, my pains. I could feel the pains of the patient in the psychiatry. So I tried to treat them in a very short time. How can I do this? In a short time and effective therapy. How can I do this? So I learned EMDR therapy, and I was in Turkish Air Force doctor at that time, and I started to study with the soldiers. They were very traumatized soldiers and military personnel and their families in the Middle East. I had experiences, very different stories, and it has affected me. The stories affected me very much. So I wandered EMDR much more. When I started EMDR therapies as a psychiatrist in Turkey in 2009, I think I was the first two or three, one of the three psychiatrists. The others were psychologists, because most of them were doing pharmacotherapy. By the EMDR therapy work, the patients liked me. I liked them because I like treating the people. I like psychiatric patients. So after 2014, I started to work in another office after I separated from Turkish Air Force. By time I came to Izmir, and Izmir patients loved me. I loved them. By time I didn't do much advertisement. While I treated much people, they heard about me, and more patients came to me because I was loving my work, and I was treating. I can treat them well and in a very short time. I think we also met with us between 2017.
That's right.
I was now by time I can. In first time, when I started the EMDR, I was treating PTSD very fast. I could treat the PTSD. By time, how can I do the other diseases? How can I treat the other diseases? Panic disorder, then I tried to treat. Bipolar disorder, I tried to treat. The generalized anxiety disorder, social phobias. And then I was the most difficult disease was obsessive compulsive disorder. But I
OCD, yeah.
OCD,
for the people
yes.
that are wondering. Yeah.
OCD, and I said I should, or I must do this. How can I do this? How can I effectively treat OCD? By Dr. Nihan, we tried virtual reality treatment. By virtual reality treatment and EMDR combination, now in 2 years we have treated a lot of OCD people. So the most important thing in my therapies is my love of EMDR and psychiatry.
That's great. We'll be right back. Thank you for watching the show. Welcome back. This is Life on Life Terms. We're here with Dr. Mehmet Oguz from Izmir, Turkey, and we're talking about EMDR therapy, PTSD, OCD, and some of the other disorders that you treat in your practice.
Yes.
Yeah. Thank you so much for doing this. I'm so happy that you agreed to do this and that we got time to do it. So maybe in closing, you can tell people a little bit about your views on pharmacology and whether what you think about that, because we know in Western medicine, a lot of times they prescribe too much. They overprescribe, they upsell, and they try to get the patient on more and more and more. And what you do, doctor, is that you're allowing the people to do less, to have less medications and be less reliant on the medications. Is that so? Is that correct? Would you say?
Yes. Yes. Uh, in 2004, I was a psychiatry assistant, and saw that a lot of pharmacological agents are used in the patients. It has bothered me. I didn't love this. By time I tried to read about analytic psychiatry, dynamic psychiatry, and the other therapeutic techniques. Yes, they were alternative of the pharmacological therapy, but we are not in the beginning of the 90s. We must treat the people also in a very short period of time. So we have to treat. I decided that we have to treat effectively and also in a short period of time and without pharmacological agents. So yes, pharmacological agents help a lot of people in the world, but if we treat some of them or some of them with effective therapeutic techniques, maybe we will decline the number of the pharmacological agents, or we can cut them, stop them. So I tried to do EMDR therapy, and this was the motivation of me in 2009. By time I saw that in most of the psychiatric disorders, by an effective EMDR therapy, we could treat most of the people, and we can stop the agents or decline the number of the agents. This is very important.
Very good, very good. So, in closing, is there anything that you'd like to say to the audience?
What?
Is there anything you'd like to say to the audience about EMDR therapy in closing?
Audience.
Yeah,
yes.
The audience.
Yeah, okay. I can say that, firstly, thank you very much for this program. I am very pleased.
Thank you.
To see you again here. I can say that this, they can search every effective therapist in all around the world. Now, a lot of online or face-to-face therapies are done. We can, for example, do online therapies by applications in the Android or iOS, and a very good therapies can be done in all over the world. I say the psychiatry patients or the audience that I tell them, please search effective scientific therapies, effective psychiatrists in all over the world. Please, this brain is our brain, and we should use it very, very carefully.
Yes. Very good. Thank you so much for being on the show. This has been Life on Life Terms. Go to lifeonlifeterms.com and toddgoldfinger.com. It's been great. Thank you so much for being on the show, and hope to see you soon.
Thank you, Todd.
Thank you. Take care.
See you.